Hello, everyone. We will now begin the 2022 ICTM International Conference for Global Cooperation into Traditional Medicine. We will begin the Korea-Japan session. The Korea-Japan Symposium will discuss academic exchange and cooperation of acupuncture medicine between Korea and Japan. Throughout today's symposium, we will be providing Korean and English simultaneous interpretation. Those present here, please use the receivers. Channel 1 is for Korean and Channel 2 is for English. Those who are participating via Zoom can select the English and Korean channel and listen to the presentations in the language of your preference. The first presentation will be provided by Professor Masato from University of Niigata, and he's going to be speaking about the effects of a single acupuncture treatment, frailty indexes.
I will start my presentation. I'd like to thank the administrative staff of ICTM and JSAM for their help in making this conference presentation. The title of the presentation is The Effect of a Single Acupuncture Treatment on Frailty Indices. Background. Frailty is an intermediate state between a healthy state and a state requiring long-term care, in which physical and cognitive functions decline. In frail states, appropriate treatment and intervention can prevent progression to a care-requiring state. In a previous study, we reported the elderly people who received acupuncture treatment had more frailty patients than community-dwelling elderly people. Acupuncture, which often target painful symptoms such as stiff shoulderness, low back pain, and knee pain, is considered to be in a position to prevent frailty when targeting the elderly. If acupuncture prevents frailty, it would be highly valued medically. Therefore, research on acupuncture in frailty prevention is considered important. This slide shows about the frailty. As I mentioned earlier, frailty is positioned between a frailty state and a state requiring long-term care. Aging weakens the body, mind, and social skills, and as a result requires nursing care. Appropriate treatment can reverse frailty to a healthy state. This slide shows the frailty cycle. In frailty, there is a vicious cycle of symptoms called the frailty cycle, and sarcopenia and low nutrition are central features of the frailty cycle. We have reported that elderly people who visit acupuncture clinic have a higher rate of frailty than community-dwelling elderly people. If acupuncture improves frailty in the elderly, it will have medical and social significance. The purpose of this study was to examine the effect of a single acupuncture treatment on sarcopenia and low nutrition, which are factors of frailty in the elderly. This slide shows the subject of the study. Of the 48 subjects, 19 were male and 29 were female, with an average age of 75.0 plus minus 6.3 years. The subjects were not certified as needing support or long-term care. The subjects received acupuncture treatment at Meiji University of Integrative Medicine Affiliated Acupuncture Center. This slide shows the methodology of the study. The frailty of the 48 subjects was determined using a Kihon checklist created by a research group of the Ministry of Health, Labor and Welfare of Japan. Next, I will explain the contents of the measurement items. The grip strength of the dominant hand, walking ability by 3 meter TUGT, and balance ability by FRT were adopted as indicators of sarcopenia. The maximum tongue pressure value, which correlates with swallowing ability, was adopted as an index of nutritional states. Each index was measured before and after acupuncture, which was performed according to each symptom. The following slide shows the research results. On the right side of this slide shows Kihon checklist and criteria for judging frailty. Of the 48 subjects, 12 were frailty, 17 were pre-frailty, and 19 were non-frailty by the Kihon checklist. The slide shows grip strength, TUGT, FRT, and maximum tongue pressure values for all 48 cases and each frailty level. No significant changes were observed in grip strength, TUGT, FRT, or maximum tongue pressure values in all 48 patients. The degree of frailty didn't affect the changes in index values due to acupuncture. The slide shows the result of examination for each index, that is, changes in grip strength. From the average grip strength of the elderly, cases with a deviation value of 45 or less were set as the muscle weakness group. The muscle weakness group is shown in blue letters. Grip strength improved in 59.1% of the weak muscle group compared to 36.4% in the normal muscle group. The percentage of cases in which grip strength was improved by acupuncture was higher in the weak muscle group than in the normal muscle group. The slide shows changes in 3-meter TUGT that indicate walking ability. 3-meter TUGT of 11 seconds or more is one of the criteria for determining locomotive syndrome. Therefore, the 3-meter TUGT of 11 seconds or more was set as the frail gait group. The frail gait group is shown in blue letters. A shortening of TUGT by 10% or more was observed in 83.3% of the frail gait group and 38.2% of the normal gait group. The percentage of cases in which 3-meter TUGT was shortened by 10% or more with acupuncture was higher in the frail gait group than in the normal gait group. The slide shows changes in FRT that indicate balance ability. In elderly people, an FRT of 26.5 cm less than has been reported to increase the risk of falling, and an FRT of less than 6 inches equal 15.3 cm has been reported to further increase the risk of falling within 6 months. Therefore, FRT less than 26.5 cm was set to poorly balanced frailty group, and FRT less than 6 inches was set to very poorly balanced frailty group. Poorly balanced frailty group and very poorly balanced frailty group were shown in blue letters. Extension of FRT was observed in 50% of the poorly balanced frailty group and all subjects in the very poorly balanced frailty group and 25.0% of the healthy balanced group. The percentage of cases in which FRT was extended by acupuncture was higher in the poorly balanced frailty group than in the healthy balanced group. The slide shows changes in the maximum tongue pressure value that indicate nutritional status. It has been reported that maximum tongue pressure should be 30 kPa or more for those in their 60s and 20 kPa or more for those over 70, based on the average and standard deviation for each age group. Therefore, the weak tongue pressure group was defined as less than 30 kPa in the 60s and less than 20 kPa in the 70s and over. Improvement in maximum tongue pressure was observed in 71.4% of the weak tongue pressure group and 45.5% of the normal tongue pressure group. The percentage of cases in which the maximum tongue pressure value was improved by acupuncture was higher in the weak tongue pressure group than in the normal tongue pressure group. Discussion and conclusion. 1. In 48 elderly people, muscle strength hand grip strength, working ability, 30-mate TUGT, balanced ability, FRT, and maximum tongue pressure were measured before and after single acupuncture treatment. 2. In the frailty check using the Kihon checklist, 12 were frail, 70 were pre-frail, and 19 were healthy. 3. In a study of all subjects n equal 48, changes in frailty indices were not clear, and frailty or non-frailty had no clear effect on changes. 4. As a result of examining each frailty index value, the percentage of cases in which the ability improved after acupuncture treatment was higher in the frail group than in the healthy group. 5. It was suggested that acupuncture treatment for the elderly improved each function in the frail state. We would like to verify that long-term acupuncture treatment is effective in preventing frailty. I will end my presentation. Thank you for your attention. Thank you to the office staff. Thank you very much.
Yes, thank you very much. That was a presentation about the effective single acupuncture treatment for frailty. Next, we're going to welcome Professor Sachiko Ikimune of Teikyo Heisei University. She's going to talk about Japan's aging population and application of acupuncture and motion study on sarcopenia and frail locomotive syndrome. Likewise, we're going to watch pre-recorded video.
Hello, I am Sachiko Ikemune from Teikyo Heisei University in Japan. Thank you for this opportunity to make this presentation today. I would like to introduce the effect of acupuncture and motion on frailty and sarcopenia, based on our previous and current research. An aging society is one in which more than 6% of the population is 65 years or older. A super-aged society is one in which more than 21% of the population is elderly. In age, Japan was the first country to become an aging society in 1970. From there, it took 24 years to become a super-aging society. After Japan, the Republic of Korea became an aging society in 2000. However, it had become a super-aging society at the first pace than Japan. Among the United States and European, France was the first to have an aging society in the 1800s. In France, there was a period of more than 100 years before the super-aging society was reached. In the countries shown here, there was a period of about 50 years or more between the aging society and the super-aging society. This data projects life expectancy in Japan through 2065. Women are expected to exceed 90 years of age by 2050, further extending life expectancy for both sexes. Therefore, the following table shows the life expectancy and healthy life expectancy in the world in 2019. The life expectancy for males shown here is over 80 years. Female life expectancy from Japan to France is over 85 years. Among them, in Japan and the Republic of Korea, it is over 160 years. On the other hand, healthy life expectancy for both male and female over 70 years. This graph shows life expectancy and healthy life expectancy in Japan over the past 20 years. As life expectancy has increased both male and female, healthy life expectancy has also increased. However, the gap between life expectancy and healthy life expectancy has not been filled. Thus, frailty in elder people has become an important worldwide concern. Frailty is defined as the status of vulnerability to engendered and extrinsic stressors that increase the risk of negative health-related outcomes. Sarcopenia is a physical frailty. Frailty and sarcopenia are conditions that increase the risk of future care. Here is a checklist for frailty and sarcopenia. Frailty is defined as 3 or more of these 5 questions. Sarcopenia is caused by loss of muscle mass as well as loss of muscle strength and physical ability. This shows the difference between frailty and sarcopenia. Frailty is a problem that targets the elderly and is not only a physical problem, but also includes mental and social problems. Sarcopenia is a condition that results in a decrease in muscle mass and is not a problem exclusive to the elderly. This figure shows the vicious cycle of sarcopenia. The vicious cycle caused by sarcopenia is thought to lead to reduced quality of life, health problems, and increased risk of death in the future. Primary sarcopenia is caused by aging. The secondary sarcopenia includes activity-related sarcopenia is caused by rest, bed rest, and weightlessness. Disuse syndrome and disuse muscle atrophy are included here. Therefore, we investigate whether acupuncture stimulation could inhibit muscle atrophy. The figure here shows the skeletal muscle after 1 month of acupuncture. In 2007, Takaka reported on the effect of acupuncture on the skeletal muscle. One of his findings was that continuous acupuncture activates satellite cells. This figure shows the presence of satellite cells using H-stain and PCM8 antibody. The possibility of muscle hypertrophy due to satellite cell activity demonstrated schematically. Satellite cells normally exist in a quiescent state within skeletal muscle. These cells normally exist in a resting state on the side of muscle fibers, but once activated, they proliferate and differentiate, eventually fusing with existing muscle fibers, leading to muscle hypertrophy. In other words, activation of satellite cells by acupuncture stimulation may induce muscle atrophy. Next, the results using the myostatin gene were used to verify the possibility of muscle hypertrophy by acupuncture. Changes in myostatin gene expression after long-term repeating stimulation. All acupuncture were applied for 15 minutes with 1.2 Hz repetitions. There was significant difference in gene expression between control and acupuncture at time point. The suppression of myostatin gene expression by repeating acupuncture may be due to muscle hypertrophy. What is the myosin gene? The myosin gene is a factor that suppresses blood cells in the skeletal muscle. The figure on the left is a picture of child deficient the myosin gene. The right shows pigs with and without the myosin gene. Reduced myosin gene expression induced abnormal muscle hypertrophy. We examined the acupuncture frequency at which the myosin gene is most reduced. Full frequency of acupuncture was studied: 1, 5, 10, and 40 Hz. The result after 3 hours of acupuncture indicated that 10 Hz suppressed the myosin gene the most. However, other studies have used to 5 Hz and 20 Hz, so further research is needed. We examined the effect of acupuncture on hand limb suspended mass. Based on the previous result, 10 Hz stimulation was applied to the triceps muscle for 30 minutes. Stimulation was performed every 2 days, and acupuncture performed 4 times in a week. Relative muscle mass is the result of source muscle mass divided by body weight. WT is the control. HS had very low relative muscle mass than control and EA per HS. On the other hand, there was no significant difference the EA and the control. Myofiber diameter was measured at the short diameter of more than 100 myofibers per square mass sample. HS had significantly decreased muscle fiber diameter than control or EA per HS. But there was no significant difference between EA per HS and control. An association between myosin and muscle atrophy-related genes was shown. Muscle atrophy is an imbalance between muscle protein synthesis and muscle protein degradation. When muscle protein degradation is increased, muscle atrophy occurs. Increased expression of the myosin gene suppress signals that promote muscle protein synthesis, such as AKT. Muscle atrophy increases the expression of muscle atrophy-related genes, such as MAF-BOX and MURF1. This increase in gene expression promotes the degradation of muscle protein. In other words, muscle atrophy is caused by increased expression of muscle atrophy-related genes and promotion of protein degradation. The table below shows the changes in the myosin MURF1 and MAFBX induced by acupuncture. These are compared to controls. As a result, the expression of genes related to muscle atrophy was suppressed in EA per HS. HS group decreased muscle mass and muscle fiber diameter. In addition, there was an increase in myosin and MAFBX gene. These results suggested that HS-induced muscle atrophy is caused by exerted protein degradation. There was no significant difference in the expression of level of myosin between EA per HS and control. However, both MAFBX and MURF1 clearly decreased by this measure compared to control. These results indicated that protein synthesis was maintained by acupuncture. The conclusion of this research: HS caused muscle atrophy. repeated year during HS suppressed muscle atrophy. It thought that the mechanism is that muscle protein degradation is suppressed and muscle mass and maintained. Locomotive syndrome was proposed by Japanese Orthopedic Association. It is defined as a high-risk condition that requires care due to locomotor disorder. In other words, it is a condition in which mobility is reduced. The next 7 questions are called RoK-check. The RoK-check is a simple self-check for learning the risk of locomotive syndromes. Risk of locomotive syndrome is defined as having at least of these items. Therefore, the RoK-check identifies individuals at risk for ambulatory function or locomotive syndromes. Nogue performed the RoK-check on the sample of people aged 60 years and older. The figure on the left shows the percentage of people positive for each item. You need to use handrail when going upstairs. Was positive for over 19% of the respondents. The figure on the right shows the distribution of the number of yes response to the RoK-check. 12.7% of the respondents were negative. The most common number of RoK-check was 3. Schemas show the positive rate of RoK-check by age group. More than half of those in their 50s and older had one or more RoK-checks. The percentage exceeds 80% for those over 75 years of age. On the other hand, among those in their 20s and 40s, 20% to 30% answered yes to at least one of the RoK-checks. Therefore, we conducted a RoK-check in 2019 for university students. The number of respondents was 174 males and 98 females. At least one yes response to the RoK-check was given by 80.9% of the male and 36.9% of the females. The previous study showed that those in their 60s and older were more likely to respond. You need to use the handrail when going upstairs. On the other hand, university students answered, you stumble or sleep in your house at a high rate. There are tests to assess locomotive syndrome. It consists of 3 parts. The standing up test examines the ability to vertical movement. The 2-step test examines that for a horizontal movement. GLFS 25 screens symptoms and function of musculoskeletal organs. The level of locomotion is determined from 3 tests. Level 1 is beginning to lose mobility. Level 2 is this locomotive syndrome risk test for university students. The subject was 53 males and 21 females. The LS group was defined as those with a LS level of 1 or higher. Those with less than level 1 were considered as non-LS group. The LS group consisted of subjects with a GLFS 25 score of 7 or higher. Judged by one leg standing time were compared for the 4 groups. Only the female LS had mean value of 4, which was lower than that of the non-LS group. Therefore, this study evaluated the balanceability by acupuncture and motion. First, here are the result of the gravity measurement. Circular acupuncture to the lower extremities resulted in a decrease in total trajectory length. Next, we assessed the time to stand on one leg with closed eye. Stimulation of motion to the lower leg prolonged the time. Next, we measured the gravity measurement in 3 subjects before and after motion. As a result, subject A clearly decreased total trajectory length. When asked how this different from the other 2 subjects, only A was called. These are our current research keywords. We will summarize the result of this study. If you are not getting adequate nutrition and exercise now, they may become frail in the future. To counteract this, proper diet and exercise are necessary. In addition, physical elements need to be corrected. Acupuncture and alternative medicine are ways to improve these physical problems. In the future, various efforts should be made early on to prevent frailty, sarcopenia, and locomotive syndrome. Our current research is supported by these grants. Thank you for your attention.
Thank you very much. We heard from Professor Hachiko. Next, we will go on to the next presentation, which will be delivered by Professor of Kyunghee University, Byung-Kwan Seo. He is going to be speaking about traditional medicine for sarcopenia, experimental approaches to potential candidates.
Hello, it's a great honor to have this opportunity to present my little research on sarcopenia. It's unfortunate to be unable to make a discussion in person due to the COVID-19 pandemic state. I wish the health and well-being of all those suffering from COVID-19. Today's presentation is about the sarcopenia, the experimental approaches to potential candidates. As most renowned field of medicine, we are approaching for the sarcopenia patients with the traditional medicine intervention like invigorating muscles and bones with herbs or stimulating muscles with the acupuncture-related modalities. Throughout my humble researches, our team can find some points for the approach to therapeutical candidates in sarcopenia. As introduced earlier, I am Professor Seo Byung-Kwan from Kyunghee University, working as the Vice Chairman of the Korean Acupuncture and Moxibustion Medicine Society in General and Insurance part. Currently, I am an Insurance Director of the Society of Korean Medicine and an Academic Director of the Association of Korean Medicine. Today, I would like to talk about sarcopenia, the definition, especially clinical definition, classification of potential candidates and mechanisms, examples of traditional medicine modalities on muscular atrophy in experimental studies. As you know, sarcopenia has no definite clinical definition. Generally speaking, sarcopenia is a condition characterized by loss of skeletal muscle mass and function. Basically, sarcopenia can be seen in general old population without specific disease. Its development may be associated with some medical conditions not exclusively seen in older persons. Sarcopenia is a syndrome characterized by progressive and generalized loss of skeletal muscle mass and strength, and it is strictly correlated with physical disability, poor quality of life, and death. One of the main consensus definitions by European Working Group on Sarcopenia in older people, the presence of low skeletal muscle mass and either low muscle strength, example, hand grip, or low muscle performance, like walking speed or muscle power. When all three conditions are present, severe sarcopenia may be diagnosed. One of the most important diagnostic parameters is walking speed. For example, 4-minute walking test. First, if below 0.8 meters per sec at a 4-meter walking test, measure muscle mass. It can be defined by muscle mass divided by height squared. If below 2 standard deviation of normal young man, as defined using dual energy X-ray absorptiometry, and if higher than 0.8 meter per sec, we have to test hand grip strength. If a value is lower than 20 kg in woman and 30 kg in man, the muscle mass must be analyzed. Risk factors for sarcopenia include age, gender, and level of physical activity. In conditions such as malignancy, rheumatoid arthritis, and aging, lean body mass is lost, while fat mass may be preserved or even increased. The loss of muscle mass may be associated with increased body fat, so that despite normal weight, there is a marked weakness. This is a condition called sarcopenic obesity. We can find an important correlation between inactivity and losses of muscle mass and strength. It can suggest that physical activity should be a protective factor for the prevention but also the management of sarcopenia. Furthermore, one of the first steps to be taken for a person with sarcopenia or clinical frailty is to ensure that the sarcopenic patient is receiving correct and sufficient nutrition. Sarcopenia has a greater effect on survival. It should be important to prevent or postpone as much as possible the onset of this condition to enhance survival and to reduce the demand for long-term care. Interventions for sarcopenia need to be developed with the most attention on exercise and nutritional interventions. We can find some distinct phenotypic changes in skeletal muscle by accelerating protein degradation. Muscle wasting and weakness is a complex and highly regulated phenomenon characterized by a substantial decrease in muscle fiber cross-sectional area, a myonuclear number, protein content, and muscle strength, while increasing in fatigability and resistance to insulin. In this regard, we can find some potential candidates in published papers like natural compounds, enzyme inhibitors, beta-androgen receptor agonists, anti-cytokines agents, or other investigational drugs. Mechanistic data of these drugs regulate the skeletal muscle loss either by downregulating myostatin, cyclooxygenase 2 pro-inflammatory cytokines mediated catalytic wasting, or by upregulating cyclic AMP, peroxisome proliferator activated receptor gamma co-activator 1, growth hormone or insulin-like growth factor 1, phosphatidylinositide 3, kinase, protein kinase, beta, mediated anabolic pathways. Various disease models were used to assess the effectiveness of CAM modalities. Most commonly used model was the hind limb suspension method, nerve damage induced model, chronic kidney disease model, alcohol induced model, transgenic model, cancer induced cachexia or stroke, diabetes models was used. Most common types of interventions were herbal medicine and electroacupuncture. The treatment period were 2 to 4 weeks or 1 to 6 months in 8 studies. It means through the experimental studies, we are always aiming to find some scientific evidence reflecting clinical settings. Electroacupuncture inhibited the expression of MURF1 gene and also elevated the expression of AKT1 and TLPV4. Ecaritin extract was used, which inhibited reduced phosphorylation of PI1K-10 P100-101, thereby promoting protein synthesis. In addition, the extract inhibited muscle atrophy through modulation of the FOXO3A and FOXO1, the all subclasses of the forkhead family of transcription factors. Using the nerve damaged model, radix prairie extract was found to significantly inhibit BEX and not BCL2. Radix dipsaki extract significantly inhibit both BEX and the BCL2 expression. 보양환호탕 decreased inflammatory cells through the activation of angiopoietin-like protein 4 and inhibited muscle cell apoptosis in the denervated dependent skeletal muscle atrophy model. The effect of 보양환호탕 was mediated by the increased expression of NF-kappa B and MURF1. And 보양환호탕 increased the NF-kappa B, P65 and MURF1. In the stroke-induced model, the radix dipsaki extract inhibited the slow to fast shift phenomenon in muscle fibers and MHC2 expression while increasing MyoD expression and thereby significant efficacy in muscle recovery. In the diabetes-induced model, insulin-like growth factor 1 was the main factor measured. Low frequency electroacupuncture stimulation promoted IGF-1, and additionally, LFES increased PAX2 genes MyoD, myogenin, and E-MyHC. Jimu-Hubai her pair promoted IGF-1 and inactivated FOX3 protein. TM promoted protein synthesis and inhibited degradation by enhancing the PI3K, AKT, mTOR signaling pathway. It also inhibited the ubiquitin proteasome system, which was involved in protein degradation. Markers of muscle protein synthesis and muscle atrophy inhibitors were measured to find their treatment mechanism. In those mechanisms, changes in growth hormone, IGF-1 productivity and sensitivity by aging, decrease of muscle protein by pro-inflammatory cytokines such as TNF-alpha, interleukin-1, interleukin-6, etc. Acceleration of apoptosis in muscle cells, also ubiquitin proteasome proteolytic pathways, and AKT-mTOR signaling pathway were found to be important factors contributing to treatment effect in TM. So we can find some clinical meaning in these experimental studies. Through our research, we can find some clinical meanings, and we have to focus more possible modalities beyond just the acupuncture or other medicine, especially for the invigoration. So we can take more steps, take more steps for the scientific advances in this field. Thank you for your attention. If you have any questions, feel free to contact me through my email. And I wish we can meet in person next year. Thank you.
Yes, thank you for the presentation. That was Professor Byung-Kwan Seo of Kyunghee University. Next topic is acupuncture treatment for sarcopenia based on traditional medicine texts. Professor Dr. Yes Lee of Jiaxing Medical Foundation will give the presentation.
Good afternoon, everyone. My name is Yesul Lee, and I will present about acupuncture treatment for sarcopenia based on traditional medicine texts. Okay, so here are the contents that I will present today. First of all, I will focus on diagnostic guides for sarcopenia, and then I will present symptoms and signs of sarcopenia, moving on to definitions of 위증 and classical medical excerpts, text excerpts on flaccidity or withering disorder. Lastly, I will focus on acupuncture indications from textbooks as well as case reports. Okay, so first of all, very recently, Asian Working Group for Sarcopenia presented another guideline for diagnostic text for sarcopenia. Well, definition of sarcopenia focuses on the decrease in muscle strength and or a decrease in body function in addition to the decrease in muscle mass associated with aging. Now you can see that there are 4 different sarcopenic variables. 1 is low muscle strength, 2 is low physical performance, number 3 is low muscle mass, and lastly, case findings including SARC-F and calf circumference. Now, if you look at these criteria, you can see that some of them match what has been written on classical medical texts. For example, aging is often mentioned in classical medical texts, known as 노화 in Korean, and low muscle strength are focused on 근약 or weakness in muscles, low physical performance, referring to 신체 강약, which is overall low performance of the body, and low muscle mass, referring to 3 different terms in Korean texts, including 근위, 기위, and 근소. So if you look at what has been written in classical medical texts, including Chinese medicine, Korean medicine, and Kampo medicine, you can see that it's been referred to as Wei flaccidity disorders, or wilting or Wei flaccidity pattern. These refer to a group of disorders characterized by limb weakness and muscle atrophy caused by malnourishment of the muscles or sinews. They often result from damp heat, emotions, congenital weakness, age-related deficiency of the liver and kidney, or qi deficiency of the lung and spleen. Now, these are the definitions that's been written in WHO international standard terminologies on traditional Chinese medicine, which has been published very recently. If you look at 황제내경, or what has been written over 2,000 years ago, in the inner canon, there has been discussions of flaccidity or wilting disorders as well. Now, if you look at the acupuncture treatment written in 황제내경, it refers to treatment of 양명 meridian only, tonify the yang Su acupoints and circulate the Su acupoints, Hyung and Su acupoints, adjust the empty and full, and reconcile the flows. It also mentions that therefore when Yangmyeong meridian is empty, the belt meridian loses its ability to adjust and reconcile the flows, eventually causing flaccidity in the feet and difficulties in walking. Now, if you look at the belt meridian, you can also say that it refers to the back overall, which refers to basically the muscles in the back, lower backs especially, and what's been circulating around your lower back. Next, I also looked up the textbooks and see what's been written as indications for acupoints regarding the following keywords, which all refers to flaccidity disorders, wilting disorders, or muscle mass decrease and muscle weaknesses. I also looked up at both the upper limbs and lower limbs to specify what's been prescribed for both lower and upper limbs. You can see that there are about 58 acupoints on muscle weakness, paralysis, and muscle loss. There is 1 acupoint in the large intestine meridian, 5 stomach acupoints, 1 spleen meridian acupoint, 18 bladder meridian acupoints, 2 kidney meridian acupoints, 1 triple energizer acupoint, 8 gallbladder acupoints, 1 liver acupoint, 4 governor vessel acupoints, and lastly, 7 extra acupoints. You can see that the majority of them belong to the bladder meridian acupoints, indicating that most of the acupoints used for muscle weakness disorders belong to what's been in the lower back and the lower limbs. Now I will look over the meridians one by one. Number 1 is large intestine meridian, or hand yangmyeong large intestine meridian in Korean. There is 1 acupoint specifically referring to the treatment of flaccidity or muscle weakness disorder, which is LI11 or gokji. It also refers to 합혈 of the large intestine meridian. If you look at the indications of gokji or LI11, it says joint pain in the upper limbs, paralysis of the upper limbs, and hemiplegia. Moving on to the stomach meridian, there is 5 on the legs, ST 31, 32, and 33, all of which refer to paralysis of the lower limbs. ST 38 and 39 also referring to paralysis of the lower limbs. There is also 1 acupoint coming from spleen meridian, which is nugok. It also refers to treatment of paralysis of the lower limbs. Like I mentioned earlier, there are 18 acupoints from the bladder meridian. If you look at the back, the upper back, there is bladder 12 and bladder 43, which refers to the weakness of the muscles at the back. If you look at bladder 23, 24, 51, and 52, all of this refer to the upper lower back around the thoracic and upper lumbar vertebra, which refers to the indications of damage in the soft tissue at the lumbar region and paralysis of the lower limbs. And then there are also bladder 31, 32, 54, and 54, which all refer to paralysis of the lower limbs. And also bladder 54 also includes the damage in the thigh muscles. Now going down to your legs, there are bladder 36, 37, and 40, as well as bladder 38 and 40, which all refer to bladder paralysis of the lower limbs, as well as the lateral region of the lower limbs, and lastly, muscle spasms of gastrocnemius. So if you look at bladder 56, 57, 59, and 60, these are the acupoints that you can find in the lower legs, which mostly treat paralysis of the lower limbs, as well as muscle spasms of gastrocnemius. Now, if you look at the kidney meridian, interestingly, you can also see that there is KI1, which is located at the sole of your foot. and also KI3, all of which treat paralysis of the lower limbs, which is very specific for kidney meridian, because mostly you've seen that the acupoints were located in the upper back, lower back, and the legs. But for kidney meridian, you can see that they are located on your foot. For triple energizer meridian, there is hadok, which is paralysis of the upper limbs. And for gallbladder meridian, you can see that most of the acupoints are located in your lower legs. GB 30, 31, 32, 33, also 34, 35, and 38, all of which refer to paralysis of the lower limbs. Some of them are very famous for treating the muscle diseases, including GB 34, Yanglingcheon, and also GB 33, Suryangwan. You can also see that for GB 38, Yangbo, it also treats hemiplegia. Okay, so we're almost done with the textbooks, going through the textbooks. The liver meridian includes one acupoint, Jungbo, which is LR6, treating paralysis of the lower limbs. Now going to the extra meridians, one is governor vessel, GB 2, 3, and 6, all treating paralysis of the lower limbs. And there is also GB 14, which treats the overall paralysis. Now, lastly, looking at the extra acupoints, there is EXLE 1, 6, and 7, which all of which treat paralysis of the lower limbs. And lastly, there is also two extra acupoints from your lower back, which is damage in the lumbar muscles, treating EXB 7 and 8. Okay, so far we've been looking at the acupoints as indicated from the textbooks from the Colleges of Korean Medicine in Korea. Now I will look at two representative cases that's been published a while ago. One is case 1 of the sarcopenia with unspecified cause, a 58-year-old male. Now, what we've been looking at so far from the textbook is that acupoints treated or indications of the acupoints usually refer to the local acupoints, but you can see that from case 1, the treatment for sarcopenia included Sam acupuncture, which is basically treating the patients for distal using distal acupoints. In specific, in this case, the authors use stomach meridian tonification method, which basically tries to tonify the stomach meridian by tonifying the fire acupoints as well as releasing the wood acupoint. If you look at the moxibustion method, you can see that they also use GB34, LR3, ST36, and ST41, all of which were mentioned above from the textbooks. And they also use velvet antler pharmacopuncture to apply a local region acupoint treatment. If you look at the changes of the symptoms as reported in the case report, you can see that overall they treated the patient for more than a month, about 42 days. And you can see that the weakness was very low in the beginning, but it really improved over time after 1.5 months to the weakness of level 4, which has been below level 3 and 2 before. And the patient was able to walk after the treatment. Okay, so going to case 2, you can see that the 41-year-old male was also treated with sarcopenia with unspecified cause. And you can see that this patient was treated with another treatment of Sam acupuncture in specific kidney meridian tonification method, which in specific tries to tonify the kidney meridian by tonifying the metal acupoint and also by releasing the earth acupoint. Now, they also used moxibustion in the BL26, which is located at the back, lower back. And you can see that Over time, this patient improved very much as well. You can see that the weakness improved over time dramatically. And also, you can see that what's interesting in this case report was that the circumference of the change of the thigh and calf increased dramatically over time as the acupuncture treatment went on. So in conclusion, you can see that first of all, from the classical medical literature, you can see that the text links symptoms of sarcopenia with flaccidity and withering syndrome, and it also refers that treat Yangmyeong meridian only, tonify Hyung and Su acupoints, adjust the empty and full, and reconcile the flows. If you look at what's been written in the current textbook of acupuncture, it shows mostly the local acupoints in the arms, legs, and back to address the symptoms around that region. Now, lastly, if you look at the case reports, you can see that the selection of distal acupoints was used very much, very commonly, and to address the underlying patterns of sarcopenia, which was mainly stomach and kidney deficiency, and also to apply moxibustion and pharmacopuncture. If you have any more questions, please don't hesitate to contact me through email. Thank you very much.
Thank you very much. With the presentation of Professor Yesil Lee, we will now bring to an end the Korea RoK-Japan Symposium 1 discussion on academic exchange and cooperation of acupuncture medicine between Korea and Japan. Following this symposium, we will go on to the RoK China Symposium, the role of traditional medicine in the post-COVID-19 era. In 10 minutes, we will have many insightful and valuable presentations. So we ask you to be with us.